to the systemic complication of local anesthesia. We'll see what are all the systemic complications, which includes overdose, allergic. There are two categories, overdose and allergic. The name itself states that overdose. When you administrate the drug beyond its dose, it's called overdose. When the patient started to show a reaction to that, the agent, what you're going to give to the patient, that's called allergic. So what are all the predisposing factors, and there are clinical manifestations and the managements are there. Overdose, it occurs when the drug access to the circulatory system. Normally, there is a constant absorption of the drug from the site of admission into its circulatory system, and a constant removal from the blood by the liver. So this is the common process. When you administrate the drug, there is a constant amount will be absorbed into circulation and the constant amount will be removed from the blood by the liver. So what are all the predisposing factors for the overdose, which includes patient and the drug factors. Patient factors include age, weight, medications, gender, presence of disease, genetics, mental attitude. Drug factors include vasoactivity, concentration, dose, route of administration, route of injection, vascularity of the injection site, and the presence of the vasoconstrictors. Coming into the patient factors in detail, age. What does the age determines? The function of absorption, metabolism, and excretion are diminished in the older age. Increase the half-life of the drug in the circulation bed. Weight, greater body weight, larger the dose. Medications, meperidine, a narcotic analgesic, phenytoin, anticonvulsant, quinidine, an antidysarthmic, and the desipramine, antidepressant. These are all the drugs which increases the local anesthesia blood level because of the protein bending competition. Coming to the gender, renal functions during a pregnancy may impair, leading to the increased local anesthetic blood level. In adult women, the seizure threshold is 5.8. Seizure threshold, for example, for a woman to get a seizure threshold, the dosage is 5.8 milligram per kg. In a newborn is 18.4. In the fetus is 41.9 milligram per kg. Placental clearance of the lignocaine. Presence of disease like hepatic, renal dysfunction, congestive cardiac failure decreases the liver perfusion and increases the amide local anesthesia blood level. Deficiency in enzymes include serum pseudocholinesterase. It's responsible for the biotransformation of ester group of local anesthetic agents. Whenever the patient presents with deficiency of this pseudocholinesterase, the level of the ester group of local anesthesia in the blood will increase. Mental attitude, patient who are fearful, larger doses required and the lower threshold, seizure threshold has been required. Coming into the drug factor, vasoactivity. Vasodilating properties of local anesthesia leads to shorter duration of clinical anesthesia, increased blood level of local anesthesia. Lower the concentration should be given, a smaller dose should be given. Route of administration should be care about intravascular injection. Rate of injection is slow, 60 seconds IV administration per cartridge. Vascularity, rapid of absorption. Vasoconstriction decreases the absorption of the drug. How to prevent the overdose? Use an aspiration syringe, use a needle smaller than a 25 gauge. Aspirate in at least 2 planes before injection. Slowly inject the anesthetic solution. What are all the manifestations? Patient will develop talkativeness, apprehensions, excitability, slurred speech, and stutter. Sweating, vomiting, failure to follow the commands, elevation of blood pressure, heart rate, respiratory rate, tonic-clonic seizure in IT overdose, sinus depression, and myocardial depression, cardiac arrest will occur. This picture shows that the patient will have excess of sweating, increased heart rate, blood pressure, respiratory rate, and this picture shows the patient has the tonic-clonic seizure activity. Coming into the management, if the dosage is very minimum, slow onset of less than a 5 minutes, or more than a 5 minutes or more than 15 minutes. Severe overdose, the condition like rapid onset, within a 1 minute the patient has symptoms, it's called a severe overdose. Slow onset of 5 to 15 minutes, within that period of the patient develops symptoms is called as a severe overdose. Management, basic emergency management. It includes PCABD: position, circulation, airway, breathing, definitive care. Mild overdose, the patient is conscious, the symptoms will develop as more than 5 minutes. Reassure the patient, administer oxygen via the nasal canal, monitor and record vital signs. IV anticonvulsants includes diazepams, 5 milligram per minute, or midazolam, 1 milligram per minute is an option, can be given to the patient. Emergency medical assistance should be given before patient gets discharged. If it is like mild overdose, more than 15 minutes, the patient will develop the symptoms similar to that of the mild overdose. If the symptoms develop within more than 5 minutes. Reassure the patient, administer oxygen via the nasal canal, monitor and record vital signs, and the same IV convulsant and medical assistance should be given. Coming to the severe overdose, if the rapid onset within a minute, protect the patient and immediately summon emergency medical assistance should be given. Continue basic life support and give an anticonvulsant, diazepam 5 milligram per minute or midazolam if seizure protract more than 4 minutes. Severe overdose, a slow onset 5 to 15 minutes. IV anticonvulsant includes diazepam, midazolam, and oxygen administration should be given. Immediately, emergency assistance should be aided. Continued BLS, vasopressor, and IV fluid is recommended for the management of hypotension. Coming to the second systemic complication, which includes allergy. What is this allergy? Hypersensitive state acquired through exposure to a particular allergen. Allergic reactions cover a broad spectrum clinical manifestations ranging from mild and delayed response occurring as long as 48 hours after exposure to the allergen to an immediate and threatening reaction. So it may vary. Mild to immediate reactions develops within seconds of an exposure. Predisposing factors: sodium bisulfate, antioxidant in a vasoconstricted local anesthesia, epinephrine, latex. Topical anesthesia includes mostly ester. Preservatives containing such as methylparaben, ethylparaben, or polyparaben. Manifestations: dermatological reaction, respiratory reaction, generalized anaphylaxis. So this is a dermatological reaction. This picture shows urticaria. This picture shows the angioedema. Respiratory reaction: bronchospasm, respiratory distress, dyspnea, wheezing, flushing, cyanosis, respirations, tachycardia, anxiety. Laryngeal edema, extension of edema to lungs, the life-threatening emergencies. Generalized anaphylaxis, skin reactions, smooth muscle spasm of GIT and urinary tract and the bronchospasm, respiratory distress, cardiovascular collapse will occur. Treatment of NT reactions may terminate rapidly, but hypotension and the laryngeal edema may persist for hard to days. For remaining other things, the treatment can be terminated rapidly, but only the two, especially conditions like hypotension, laryngeal edema, the treatment has to be continued for hours to days. Skin reaction, delayed or immediate. Respiratory reactions, bronchospasm or laryngeal edema. Anaphylaxis, sign of allergy present or no sign of allergy present. So these are all the conditions will determine how to manage the patient. If it is like delayed reaction, only thing is that oral histamine blocker 50 milligram of diphenhydramine or 10 milligram of chlorpheniramine maleate should be given to the patient for 3 to 4 days. Observe the patient for 1 hour. Medical consultation should be sought. If the patient is drowsiness, not allowed to leave the patient from the clinic. If it is like immediate reaction, epinephrine of 0.3 mg should be given intramuscularly. IM histamine blocker 50 mg of diphenhydramine or 10 mg of chlorpheniramine. Medical consultation, observation for 1 hour, prescribe oral histamine for 3 days. Sorry, it's like oral antihistamines has to be given to the patient for 3 days. Coming to the bronchospasm, administer the oxygen at a flow of 5 to 6 liters per minute. Ephedrine 0.3 IM or bronchodilator albuterol. Dose should be repeated 10 to 15 minutes if needed. Observe the patient for 1 hour. Given IM and histamine blockers 50 mg of diphenhydramine or 10 mg of chlorpheniramine. Medical consultations should be seen and prescribe oral antihistamines for 3 days. Coming to the laryngeal edema, if the patient is unconscious, just give a IM epinephrine, activate the emergency medical service, IM histamine blockers, steroids, IM or IV, 100 mg hydrocortisone, sodium succinate to inhibit and decrease edema, perform cricothyrotomy. So this picture shows the region where the cricoid cartilage is located, and this is indicate the incision should be placed transversely between the thyroid and the cricoid cartilage. This is called cricothyrotomy. When a patient develops generalized anaphylaxis, signs of allergy present, if there is and signs of allergy present, epinephrine 0.3 mg should be given, administered oxygen, monitor vital signs, recorded every 5 minutes, IM histamine blockers and corticosteroids should be given to the patient. The clinical improvement noted increased blood pressures and decreased bronchospasm. If there is no sign of allergen present, seek a medical assistance, administered oxygen, monitor vital signs, recorded every 5 minutes, additional management on arrival of emergency medical personnel, depend on the cause on the field, loss of consciousness. These are all the references. Still now we have seen the local complication as a separate class and systemic complication separate class. Systemic has only two complications, overdose and the allergy. What is it? We have seen what is overdose and what are the predisposing factors for overdose, and what the patient will present, how the patient will be present, and what are all the management available for overdose. Similarly, allergy, what are the predisposing factors, and what are the clinical manifestations, and how to prevent the each allergic reaction. Thank you.